name is Lauren Hackey. Today I'm basically going to be going over range of motion assessments for the knee as well as manual muscle tests and muscle length tests. So I'm going to have the patient start out in supine, and I'm going to go ahead and measure her knee flexion first. So what I want to do is I want to go ahead and instruct the patient to have their ankle try and hit their bottom as much as they can to flex his knees for me. So go ahead and do that. Again, this is going to be an active range of motion. So what I'm going to do is basically line up my goniometer with the joint line here. That's going to be my axis. My stationary arm is going to be in line with the greater trochanter here. And then my movement arm is going to be in line with the lateral malleolus. And so right here I can already see that she's got 140 degrees of flexion, which is more than normal. Normal range of motion for this would be 135. So if you can go ahead and move your leg down for me here. And I'm going to be measuring extension for the knee. So what I'm going to be doing is placing this towel underneath her ankle here to get full range of motion for the knee. And what I'm also going to do is instruct the patient to flex their quads so they can get into full extension. And again, I'm going to go ahead and find the joint line. That's going to go where my axis is. My stationary arm is going to be in line with the greater trochanter. And my movement arm is going to be in line with the lateral malleolus. And here I have, she's got about 1 degree of hyperextension. Normal extension is going to be 0 at the knee itself. So we're going to go ahead and switch to manual muscle tests for the biceps femoris and semimembranosus and tendinosus. So I'm going to instruct the patient, go ahead and flip over on your stomach for me. Get that out of the way. And so what I'm going to basically do here is grab the ankle, and this is going to be my stabilization here at the ankle. It's just going to be proximal to the lateral and medial malleoli. And then I'm going to go ahead and put the patient in hip external rotation, which is going to cause the biceps femoris to go ahead and kind of activate a little bit more than the semimembranosus and tendinosus. And again, this action is going to be knee flexion. That's what the hamstring groups do. So I'm going to go ahead and have this arm stabilizing the ischial tuberosity. And I'm going to go ahead and have my patient hold here because I want to see that she's able to do this against gravity before I start moving her. So I'm going to instruct the patient to hold this position and don't let me move you, okay, Jess? And hold, 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 hold. So I can see that I would give her a 5 here because she was able to hold this position against heavy pressure. So going ahead and switching here, I'm going to go ahead and assess semimembranosus tendinosus. So I'm going to put the hip into internal rotation. Again, that motion those muscles do is going to be knee flexion. So I'm going to have her hold this position to assess that she can do it against gravity first, which again would be 3+ already. And then I'm going to again stabilize the ischial tuberosity here and above the ankle. And I'm going to go ahead and instruct the patient to hold this position. Don't let me move you. Hold, 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 hold. Perfect. And I would again give her a 5 out of 5 again because she was able to hold that position with heavy pressure. All right, and so the last thing that I'm going to be doing here is assessing muscle length for the rectus femoris, which we know is going to be from the AIIS and attached to the tibial tuberosity via the tendon here over the patella. So what I'm going to do is I'm going to basically stretch the patient to where their ankle is able to touch their bottom as much as I can if I feel a strong stretch or if the patient tells me this is starting to get uncomfortable. So I can see here she's almost got full stretch here along this axis because her ankle is almost touching her butt. So we already know that she does not have limited muscle length in her rectus femoris because she already had 140 degrees of flexion. But if you wanted to assess this, if you did suspect that there was an issue with the muscle length, you would measure this again, lining up with the greater trochanter, midline of the joint line here with axis, and the lateral malleolus. And that's it.